Welcome back to this last lecture about bones, where we're going to talk about how they're arranged in the skeleton, as well as naming specific bones that you need to learn. So when we talk about the skeleton, we divide it into two parts. The first part is the axial skeleton, which is this part right down here in the center. It includes your skull, the vertebral column posteriorly, to which the rib cage is attached. The rib cage includes the ribs as well as your sternum. In addition, the axial skeleton will include the hyoid bone and three ear ossicles, which are located in your middle ear, which we'll learn more about when we learn about special senses. So looking closer at bones in the axial skeleton, the skull is made out of cranial bones and facial bones. So the cranial bones make up your cranium, which is what surrounds and protects the soft tissues inside. Specifically, think about your brain, and we have some nerves in there as well. And most of these are flat bones. You can see there's quite a few of them because they're showing them in different colors here. Okay. In addition to that, we have 22 different facial bones. So you don't have to memorize how many different bones there are. Like, I'm not going to ask you, are there 8 or 9 or 7 cranial bones? And are there 20 or 24 facial bones? Just want you to have an idea of how many different bones there are. All of these bones attach to each other. The mandible is a facial bone, which is your lower jaw bone, which is more freely mobile. Your maxilla, your upper jawbone, is not mobile. It's physically attached to other facial bones. In addition to that, you can see that there are openings in a lot of your skull bones and facial bones. In fact, there's 85 different openings. And if you take anatomy, you're going to have to learn the names of, around 15 of them. They're important because certain blood vessels and nerves or nervous structures such as medulla oblongata pass through them. So they're super important. In addition, there are 4 what are called paranasal sinuses. So a sinus in this respect is an air-filled cavity that's lined by epithelium that's going to be secreting substance. And all of these air-filled cavities drain or have openings that go into the nasal cavity. And so we have one in each side of our maxilla. We have one each side here in our frontal bone. So if you get sinus infections, because these are typical places where you would get sinus headaches. Another classic place is right back here in the midline, especially back behind. And that's because that's the location of 2 other of our paranasal sinuses are. So for this class, you don't have to know the names of them, just be aware of the paranasal sinuses and where they are located. When you are born and in early childhood, up to about 15, 16 months, you can have what are called fontanelles. And that is because the fetal skull bones are not fused together. This is great news, ladies, for when you're giving birth vaginally, because it means those fetal bones can overlap slightly, and every millimeter they overlap is fantastic. It also allows for brain growth, because if they were fused together, then the brain could not grow any larger than the size of that skull. And so that's why it's not going to be fused for quite a while. And there are multiple of these fontanelles, but there's one I want to talk about, and that is this one right here, which can clearly be seen here. This large one known as the anterior fontanelle, so learn this term. This is commonly known as the baby soft spot right here, and it typically goes away by the time the baby is about 16 months of age. Continuing on with bones in the exoskeleton, a bone you may never have heard of before, is this C-shaped bone that looks like it has little horns on it. It's called the hyoid bone, and it's the only bone in your body that does not articulate, does not form a joint with any other bone in your body. There are muscles and tendons that attach to it. It's very important for swallowing, and other, it attaches to other neck muscles, attaches to your larynx. It does attach with tendons to other bones in your skull. But it's tucked right up here. It's tucked behind your lower jawbone, behind your mandible. So it's very well protected normally behind your mandible. And so it's really hard to injure it unless you are getting strangled. Okay. And if you have a case of strangulation, that is when the hyoid bone is fractured. So if you have this on your phone or an iPad, just enlarge this and you will be able to see the black line to see that this hyoid bone has been fractured. And this is what the coroner does in cases of dead bodies for unknown reasons. You will take an x-ray of the neck to look to see if the hyoid bone has been fractured, to see if the person was strangled. Because like I said, unless the mandible has been crushed from massive injury, that hyoid bone is protected, except in cases of strangulation. It doesn't fracture in hanging, okay? Because hanging doesn't go to the hyoid bone. All right. So continuing down lower, we move to the vertebral column where we have 33 different bones that attach to each other, and they're divided into 5 different types. And notice we have normal curvatures, and this is because we have an upright posture. So when we look at the 5 different types up here in the neck area, these are called the cervical vertebrae, and we have 7 of those. Then in the chest area, we take the word that means chest, which is thorax, and these are called your thoracic vertebrae, and there are 12 of these. Below the thoracic vertebrae in your lower back area, there are going to be 5 lumbar vertebrae. So an easy way to remember how many of each of these are, like you eat breakfast at 7, you eat lunch at 12, and you eat dinner at 5. Okay. So below the lumbar vertebrae, we have this triangular shaped one, which basically is 5 vertebrae which have fused together. And this whole big thing is called the sacrum. And this is located in your pelvis. And then hanging down below it, we have 3 or 4 tiny little vertebrae that make up your tailbone, and this is known as your coccyx. So learn how to spell this word, C-O-C-C-Y-X. So these 5 parts, these 5 special vertebrae make up your vertebral column. And if you take anatomy, you will learn how to tell them apart from each other because they all look distinct. Now, there are structures related to the vertebrae that are not bony. Like, for instance, if you look at this lumbar vertebrae and as well as a thoracic or a cervical vertebrae, you will notice we have this big bony area called the body, and then we have these processes, and we have this center hole area. This whole area is known as the vertebral canal. So this vertebral canal is important to know, and this is the area that contains the spinal cord. So it's about the size of, pick like one of your biggest fingers, your index finger or your middle finger, that would fit into your vertebral canal space for your vertebrae. And on this part of your vertebrae, this is where the discs would sit. Okay. Now, if you look at adjacent vertebrae, what you would notice that behind this, you can see that this goes up on this vertebrae, and this part goes down on this vertebrae. And that, when you put the two together, we kind of have this little blue space. And so we have these spaces between the vertebrae. And these are the spaces where the nerves, the spinal nerves, will be coming out at each layer. And I'll show you on the next picture what I mean. So if we look at this one, here is the spinal cord, okay? This right here is where that disc sits, and here's the spinal cord. And then coming off the spinal cord, here is where those nerves have axons going in or coming out of the spinal cord. And this is the little space where that is happening right there. And so this right here, sitting on this part of the vertebrae, is called the intervertebral disc. It's called the intervertebral because inter is a prefix that means between. And as you can see, it sits between the vertebrae, but it sits on this part of the vertebrae. It cannot sit where the vertebral canal is because that's where the spinal cord goes. Now, as you recall, we talked about before, the intervertebral disc is made out of fibrocartilage, and it's this purple outer part that is made out of that tough fibrocartilage. And then this blue part on the inside is kind of like a rubber ball. Okay, so it's very spongy. And what happens when you rupture your disc, you are tearing the fibrocartilage, okay? And so it gets damaged, you're tearing some of the cartilaginous fibers, and over time, if you tear more and more and more of them, what's going to happen is that little elastic ball is going to be able to squeeze its way out and herniate, and you can see it will push on that nerve as it's coming out through that space right there. And so that's why a herniated disc is causing the pain. It's not the torn fibrocartilage itself that causes pain because, as you know by now, because I've said it 20,000 times, cartilage does not have nerves, therefore tearing cartilage cannot hurt. It's the fact that the center part of the disc is pushing on the nerve, causing pain, that causes the herniated disc to generate the pain. Okay, so now we can have abnormal spine curvature. So in grade school, I'm sure you had tests where they had you lean over, and what they were looking for was to see if one shoulder was higher than the other, because what that shows is that we have a side-to-side curvature known as scoliosis. In a previous section, I showed you where we had compression fractures anteriorly, like in a hunchback. That is actually known as kyphosis. And then a third type of spine curvature known as lordosis is also called swayback, and that is commonly seen in pregnant ladies or in people who have very large abdomens. And you can see their very large protruding abdomen, and so their back is arched. And you can see, yes, you can see gymnasts standing sway backed at the end of their routines as well. Okay, so continuing on with the anteriorly, we have your breastbone, which is known as the sternum. It was made out of 5 to 7 bones, which has fused together. And so in the adult, we have 3 bones, but for us, we're not going to learn the specific names of the bones. All together, they form the sternum. And we have on each side, we are going to have 12 ribs on each side. So if you know that and believe that God took one rib from Adam to make Eve, and so you think that men have one less rib on one side than women, well, it's a miracle because both men and women have 12 ribs on each side. And what I want you to realize is all 12 ribs are attach posteriorly to thoracic vertebrae. They're attached in two different places. They're attached here as well as there. And then they go laterally, and then they curve and come around anteriorly. And then 10 of them are going to attach to cartilage, and that cartilage will then attach to the sternum. The lowest two vertebrae just float for a short distance, and some of them are really, and some people will only float for a really short distance, whereas in other people, they could float quite a bit longer. So it could be a 2-inch floating rib, or it could be an 8-inch floating rib. My nose doesn't look like your nose. We're all created differently, similar but different. Okay, so the ribs are attached to the thoracic vertebrae. 12 thoracic vertebrae, 12 ribs on each side. So that's it for the exoskeleton. Now, and so the exoskeleton is what was green. So now we're going to talk about what was brown. And what is brown is the appendicular skeleton, which consists of two girdles, and not the kind of girdles like a Spanx kind of girdle, but what's a shoulder girdle, which is known as a pectoral girdle, and a pelvic girdle, and attached limb bones. So to the shoulder girdle, we're going to have the upper limb attached, and to the pelvic girdle, we're going to have the lower limb attached. So the pectoral girdle consists of two bones, and only two bones, and they are your shoulder blade, which you need to learn as the scapula, and your collarbone, which you need to learn as the clavicle. So when you look at the collarbone, it's slightly S-shaped, and when you look at the clavicle, it is triangular with some little things sticking out. Now, this little part right here is the socket for the ball and socket joint, where the humerus attach. And I want you to realize that this socket is very, very shallow. But the whole point of this pectoral girdle is this is how the upper extremity is going to attach to the sternum. So the upper extremity attaches right here to this socket. This bone attaches to that bone. So the scapula attaches to the clavicle, and then the clavicle attaches to the sternum. So right here, you've got this much that attaches your entire upper extremity to your exoskeleton, less than half an inch. So now do you understand that if you break your clavicle, that whole arm is going to hang and be pretty worthless because you only had half of an inch and two bones joints to help attach it. Okay. So because this socket joint right here, where the head of the humerus attaches to the clavicle, is very shallow, we say that this is specialized for flexibility. It gives us a huge range of motion, but it's very prone for dislocation. So we have a group of 4 muscles known as the rotator cuff muscles, which go around this to try to hold it in place so it won't get dislocated. Sorry about that. Let me go back to the correct page. Okay. So these are our rotator cuff muscles trying to stabilize our shoulder. Okay. Moving on to bones in the upper limb you need to learn about. So we talked about the humerus before. So remember the humerus, it's got the head at one end, and then it has what looks like knuckles at the elbow side. Okay. So the elbow part is going to articulate with 2 bones in the forearm, because the humerus was in the arm, and now we have 2 bones in the forearm, and they are parallel to each other. On the pinky finger side, we have the ulna, beginning with the letter U. And you can tell the ulna because it's the bone that has the U-shaped divot that's going to fit into one of these knuckles really well. And that means the other bone, to learn the radius, is the one that is on the thumb side. So it's going to fit over there. And so here you can see the ulna and the radius fitting in here at the elbow. And then they're going to go all the way down here to the wrist. And then we have 8 wrist bones, don't have to learn the names of them. Then you're going to have 5 bones in the palm, don't have to learn the name of it. And then we already talked about the 14 bones in your 5 digits. And you know that these are called your phalanges because I already introduced you to that term. Okay. So moving down towards your lower extremity in your hip, okay, and so don't be using the word hip ever again in this course. But if you were to put your hands on your hips and give your parents attitude, do you see that this right here is where you'd be putting this part of your hands on your hips? And so this entire bone is called the coxal bone. So look at the spelling, C-O-X-A-L, not to be confused with the coccyx, C-O-X-X-Y-X, which was your tailbone, okay? So the coxal bone is actually made up of 3 bones, tan, pink, and purple, which fuse together in childhood. And so you have a right coxal bone and you have a left coxal bone. And right in the middle, in the front, right under your pubic hair, there's going to be a piece of fibrocartilage joining the two called the pubic symphysis. And so this is it right here. So here's your right coxal bone and here's your left coxal bone, and there's the pubic symphysis, because that sits right under your pubic hair, because that's named for this bone right here, which is called the pubis, which you don't have to know. Okay. But that brings me to the pelvic girdle, which sometimes people call the pelvis, but the pelvis is not the true name because the pelvis technically is not this whole thing, but only starts down in the lower part. So don't write pelvis, write pelvic girdle. So the pelvic girdle is an entire ring of bone. So it consists of 2 coxal bones, as well as the sacrum and coccyx posteriorly. And that's how you get this entire ring of bone. Okay. And when we look, we can see many differences between a male pelvic girdle and a female pelvic girdle. Because once you hit puberty, testosterone does stuff to help you build muscle, and estrogen doesn't do anything towards building muscle, has you build fat, and has your pelvis change for childbearing. So the male pelvis is very upright and very narrow, and the female pelvis does this. So babies' heads can come out. And so there's many different differences, but there's one I'm going to show you that's very easy to see because I put these on a black background, and that's this area right here where the pubic symphysis is. And look at this angle right here where the 2 coxal bones are joining right here. And so do you see this angle versus that angle? Now what I want you to do is take a piece of paper and look at a corner. That's a 90-degree angle. And look at this angle. Is that less than or greater than 90 degrees? And then look at the bottom one. Is that less than or greater than 90 degrees? Because this is called the subpubic angle. And in men, as seen in this upper one, it's going to be less than 90 degrees. And in women, it's going to be 110 degrees or more, because you gotta have space for that baby's head, okay, to be coming out here. So the angles are going to be bigger. All right, moving on to the lower limb and our thigh, we have the femur. Learn this bone. This is your longest and your strongest bone. So all your weight is coming through your pelvic girdle, then going onto your femur. You have your kneecap was your patella. The weight is not going on your kneecap, but all the weight from your femur then goes to your tibia. So these rounded parts of your femur then go onto this flat part of your tibia. And that's why we have those C-shaped pieces of fibrocartilage, the menisci here on the tibia that I talked about in that other video. So the tibia is the weight-bearing bone in your leg. Okay, so your leg is between your knee and your ankle. Your thigh is between your hip and your knee. So in your leg, you have two bones, the tibia and the fibula. So learn how to spell them. The tibia is the weight-bearing one. It is the medial one. It is the one when you look on the inside of your ankle, you see the bump because this big thing right here, that is making that bump. So it's on the inside of your ankle. It's the weight-bearing one. Look how big this one is compared to this skinny little guy here, the fibula. Big word, skinny bone. Does no weight bearing. You're going, well, Dr. Powell, why the hell do we even have the fibula then? Well, because there's some muscles that attach to it. Okay, so it's going to do some stuff for some ankle actions, but it's not going to do any weight bearing. Okay. And so all the weight bearing is going to come down to the tibia, which is then going to go onto this bone in your ankle, which then goes onto this big bone in your ankle. Now, we do have 5 other ankle bones because we've got 7 bones in your ankle, but I'm not going to make you learn the names of any of the ankle bones. And then we've got 5 more bones here. Whoops. In your foot before we hit the 14 phalanges. And the way the foot is arranged, we actually do have 3 different arches in your foot. You know that if you've ever stepped in water, you know that you don't have a footprint that looks like this. Your footprint goes in on the sides because of the arches in your foot. Okay, so with that, I am done. So if I wrote the name of a bone, it's because you should be able to recognize that bone and you need to know where it is in the body, plus anything else that I mentioned about that bone. So I didn't tell you about very many bones at all, maybe 10 to 12. All right, thank you so much. And I will see you when we come back and we talk about articulations. Have a great day.